Hey, I am now 2 months on T. I'm now on subcutaneous injections. I was on the patch for about a month and a half. The thing they don't tell you about the patch, which they definitely should, is that one third of people are immediately allergic to it, one third of people become allergic to it, and then one third of people don't have a problem. I was in the second group where after like 3 weeks, if I put the patch on, it would itch really badly, it would burn really badly. When I was changing the locations like I was supposed to, but like there would be these big red marks where the patch was, and it really hurt. Um, so I just went off of them, and just like went off of tea and just didn't go on injections because I was scared. Um, And then I finally was like, okay, like maybe I should get back on tea. Like this is silly. So that was in February. So from like basically January to February I wasn't on tea. And so like late February, I pulled my shit together. Um, and then instead of going to Planned Parenthood this time because Planned Parenthood is really far away from me, and they're just like really far away from me, I went to Mount Sinai's transgender clinic, which actually it's good. The only problem is like the clinic is it's like a specialty clinic, so you're not only in a room with trans people, you're in a room with like all kinds of different people. So I was kind of nervous being in the room because I didn't know. It doesn't say like transgender clinic, you know what I mean? I was kind of worried that people were giving me like weird looks and stuff, but like you could definitely clock the trans people in the room. So like we all kind of sat together, which was cool. So I went, and they barely did informed consent with me because I'd already been on T. So they basically just took my blood to check all these like levels of whatever. Um, Asked me what I was looking for in tea, told them, prescribed me tea and needles, and then I thought I was going to inject that day because that's what they told me on the phone, but that was not true. So my insurance denied the testosterone right away. So I had to do prior authorization, and then after the prior authorization, like the clinic got the tea, but then didn't get the needles, so I couldn't inject. So like it was like I want to say like at least a week and a half from my first appointment to when I actually got everything I needed and got to the clinic to inject. So I got to the clinic. The nurse showed me how to inject. So basically, she used an 18 gauge to pull the testosterone out, and then a 25 gauge to inject. I inject into my stomach because I feel more comfortable that way. I can't imagine injecting into my leg for some reason, but my stomach I have no problem with. And then I went back the week later and I injected myself, and I nearly passed out because I was so stressed, but I did it without a problem. The one thing that's like they don't tell you, I guess, is that you're so focused on getting the needle into your skin that once that happens, you like forget what to do, that you have to push the plunger and actually inject the testosterone. So this still happens. Like every time I inject tea, I like finally get into my skin because I have like a little mini like nervous moment where I'm like I can't do this, and then I do it. And then I'm like, oh my god, I have to actually like push the plunger, and so like push the plunger, and tea's really thick, so it's kind of hard to get into the body. Um, and then sometimes I like push the plunger, and then I don't realize that the plunger is like pushed all the way. There's no more tea left, and I'm just like, why isn't it going any further? And I'm like, oh, it's out. So I've been on tea, injectable tea for 2 months and a week now. My voice is cracking. Not right now, but usually when I talk or like when I talk and I get really excited, my voice cracks a lot. Or if I'm laughing or if I'm yelling. So like anything, if my voice is like above this like calm, steady level, it cracks a lot, which is pretty cool. I've started to get kind of acne in the last like week, which like it's definitely not bad, but like I usually have really good skin. Also, sorry, I'm dyeing my hair right now, and I'm also not wearing a binder because I'm dyeing my hair, and I don't want the hair to get my binder, so that's why I'm trying to keep the camera at a certain lens. Um, I've been on tea for 2 months and a week. Something really funny that's happened is I babysit a 10-year-old girl, and the whole family knows I'm trans, and they try to use my pronouns. They're not very good about it, but they're really nice. And I told the mom, like, hey, my voice is starting to crack. There's a chance that it could drop before I'm done watching your child. And she was like, oh, so just like tell, tell her, what's going on. We told her you're trans and that stuff like that, but I think, you should talk to her about the actual hormones. So I was like, hey, like, small child, like, I'm not a boy or a girl. And she was like, yeah. And I was like, okay, so I'm taking the special medication. Actually, it's not a special medication. It's a hormone that everyone has in their body. It's called testosterone. And usually if you have more of it, you look more masculine. And so I'm taking more of it so that I look more like a boy. And she was like, okay. And I was like, I'm going to be the same person, but my voice might drop. I might look a little different. You probably won't even notice, but just letting you know, so because my voice is cracking. And she was like, okay. And I was like, do you have any questions? And she was like, no, not really. I was like, okay. So, like, we kept walking. And then she was like, I have a question. And I was like, oh, no. Like, what's she going to ask me? Like, I'm stressed. I was like, what's up? And she was like, are you going to get dumb like a boy? And I was like, what? She was like, you know how boys are really dumb and stupid? And I was like, I guess. And she was like, are you gonna get dumb like a boy? I would still like you if you were dumb like a boy, but I'm just, are you gonna get dumb like a boy? And I was like, no, I don't think so. So I was like, no, I'm not gonna get dumb like a boy. I'm like the same person, I've matured past like puberty. And then she was like, oh, so like you're going through puberty twice. And I was like, yeah. And she was like, oh wow, that sucks. And I was like, thanks. So that was really fun. My period, I think, has stopped. Right now it's, I think at least 12 days late. So either I don't have my period anymore or it's really late. But I'm also like having a lot of stress. My partner's in the hospital. So I'm really stressed about that. So it could be that, but my period was late before all this happened, so I'm not quite sure. Yeah. One thing that did happen is when I first went on injectable tea, I was really depressed. Not related to going on the tea, just in general. And I kept telling my psychiatrist that I was really depressed and I wanted to change my medications around. And he kept saying, like, oh, like, tea is, in a lot of cases, tea will make SSRIs work better. I'm not sure why. I'm not a psychiatrist, but that's what my psychiatrist told me happens, is that usually, like, SSRIs work better when you have more tea in the body. I'm not sure if that's true or not. So he kept just, like, pushing it off. And then finally, after, like, a month, maybe, I was like, no, I can't push it off any longer. Like, you've got to change medication. And so he added Wellbutrin, and now I feel a lot better, which is really nice. I feel really good. So, like, the first time in a really long time, I feel pretty normal. I did a residential treatment center, which is, like, a mix between an outpatient program and an inpatient program for 8 months. And before that, I was hospitalized a bunch of times. And anyway, so I've been through the ringer, and I actually feel good for, like, the first time in a really long time, which is nice. I'm tentatively getting top surgery in January. I was supposed to be getting it actually in May, but I decided with my therapist that I wasn't ready because there's a lot of stuff, I don't really want to talk about it, but there's some stuff in my, like, intimate life that makes me feel like I need to talk more about my relationship to my body before I, like, permanently alter it, and that I didn't want to just have this major surgery and then be like, oh, I'll just deal with it after it happens. The other thing is my therapist is going away for basically all of August, and literally all of August and part of July, and I would have the surgery in late May, so I would really only be seeing my therapist for a month, and then she would be gone for a month and a half, and she was worried that, like, I wouldn't be stable because I would have just had this major surgery, and that if something happened that, if I started feeling bad, or, like, a lot of times, like, this is, like, heard, like, colloquially, I don't think that's a word. Whatever, it's heard through other trans people, is that you will get, like, major depression after you get top surgery. Like, you have a depressive episode. I've heard that from a lot of my close friends, people I've talked to online, and I didn't want that to happen while my therapist was gone. So, yeah, that's why I'm postponed top surgery. So yeah, the only things I really noticed are my voice cracking, some acne, delayed period or no period. I had a really spotty period last month, like really spotty, like barely any. Like it would be like no blood one day and then like some blood the other day and then no blood. Really, really spotty. I think I smell differently, but like I also think that that's maybe something I'm just like imagining because that's what I've heard from a lot of people is that they think they smell differently. So I might just be crazy. I haven't gained any weight, um, and I'm not any more hungry than I normally am. Um, so that's good, I guess. I don't really feel any different at all, um, which is a good thing and a bad thing, I guess. It's hard to feel like nothing is happening. The voice cracking is helping a lot because it's just like, okay, something's happening. Like I can't deny that my voice is cracking a lot. I wish I could make it crack for you on like this recording, but it cracks a lot. Like if I yell really loudly, like my voice will just crack, and like often, and we're gonna laugh, and that's really reassuring because that means my voice is gonna drop. Um, yeah. I've completely stopped wearing makeup except for I fill in my eyebrows to make them thicker. They're not filled in right now. I also bought better binders because I was using like old binders that didn't work, so I use better binders now. I got rid of all my girl underwear. I know it's dumb, but like I got rid of every one of my dresses and skirts and blouses except for I kept two dresses. Um, one that I just like really like two that I really really like, and that like maybe I could one of them I might actually cut or like get like tailored to be a shirt because it's like silk and it's like a nightgown and it's really beautiful color, and the other one is just like this really like nice dress that like I just didn't want to get rid of. But yeah, so I got rid of all my girl pants too, so I only wear men's pants. It was really hard for a while because I thought my waist was one size, so I was buying actually a size up, and so my pants were really baggy on me. They looked really bad, and I felt really like upset because I was like, why aren't pants like I look so ugly? I feel so ugly. And then finally, I was like, maybe I should try a size smaller, and I did, and then they fit normally. So I found a couple pairs of pants that actually fit well, which is really cool. Actually wearing a pair of like ugly camo pants right now that fit really well. They're super comfortable. Yeah, so yeah, I just dress a lot more masculine. Don't wear makeup. Um, it is weird. I do go to women's college. I do go to Barnard College. Um, so I do feel kind of awkward there sometimes because I don't get read as a man, which is like a bummer. But I definitely get read as like queer, which I am, or like different. And so people at Barnard, a lot of them are like really like femme or like look a certain way and like act a certain way and like are kind of cliquey. And I feel very like alienated from that because I took medical leave, because I'm trans, because I just don't really feel like I fit in. And it is really awkward being in a college where like everyone is like, hey ladies, or like, hey gals, and I'm just like, shut the fuck up. Like, can you just refer to everyone as like, hey everyone? Like, do you have to like gender it? Like, is that necessary? Like, I get it, like we're at a women's college, but like even when I like identified as a woman, I thought it was dumb when people be like, hey ladies, because that's just like just refer to us as normal people. Like, you don't have to like specify our gender, whatever. Um, so yeah. That's basically it. Um, I guess anyone who's watching, I would really recommend going on subcutaneous injections. They don't hurt at all. I'm terrified of needles. Like, I'm terrified of them. And I can do them with basically no problem. The first couple times I had my partner come over and sit with me while I did it. But now I just do it without a problem. There's like a 10-second panic before I actually have to inject. Other than that, I'm fine. The patch fucking sucks. The gel, I've heard mixed things about, and I didn't really want to have to wait for it to dry, and I have a cat, and my cat licks me a lot, so I didn't want my cat to get a lot of tea. So, I really recommend subcutaneous injections. I know that I was really stubborn, and everyone told me, do injections, and I was like, no, I'm gonna do the patch. And then, like, you know, I didn't do that. I didn't work out. So yeah. Anyway, I guess if anyone is watching this, have a good day. Bye bye.